Hola, welcome back to Crossing Cultures with Cristina Luna. Today we have Frances Ferrer, an amazing woman, professional that she went through all kinds of difficulties, adversity in her life, and she overcame it. And she became a professional that wants to take care of people. So she's going to share with us about health insurance, especially now that things are changing too much,
Mhm.
2025 towards 2026. So let's welcome Francis. Hola, Francis, ¿cómo estás?
Hello, Cristina. Thank you so much for having me. I
Yeah, I know you
appreciate
speak English, Spanish, but also this podcast is going to be in English.
that.
See, you are an amazing person. I've met you many times in different places, and I thought we have to have this woman on the show, right? Tell us a
Yeah.
little bit about you. I know that you became you know, Eureka, how you embrace both cultures. You became a teenage mom, your sisters too. And how were you able to raise your kids, have a career? What made you embrace community healthcare? And then and the second part will go about things that you need to know or you would like to know about healthcare. Tell us a little bit about you. Once upon a time, Francis.
I feel like I'm a cat. I've lived many lives. Well, my life back in New York City, I lived in Queens, New York. I raised my kids in Queens, and it's a melting pot of different people, different cultures. It's wonderful.
Mhm.
And so I proudly say that I am a New Yorican.
Nuyorican, right?
Yes,
So,
yes.
what did you get from your Nuyorican, for your Puerto Rican origins, bringing up in your culture in New York?
So one of the things that I learned very quickly is growing up in New York and being from Puerto Rico is that there is a difference. When you're not directly from the island of Puerto Rico, you can identify as a Puerto Rican, but they won't always accept you as a full Puerto Rican, right? Because you're not from the island. I'm happy that I grew up in New York City and I have that culture of New York, and I was able to take from my roots, from where my family came from, and combine both, New York City and Puerto Rico, and combine it to the person that I am today. And, what I got from Puerto Rico was salsa, and I got the food and the language, and I guess the feistiness, the spiciness that they some of them, the attitudes, is some attitude from New York, and then the combination of the two um, has made me a very strong person, I think, as and resilient, definitely resilient.
So tell us about being a teenage mom. Well, we know how those things happen, but your sisters too. How did you deal with that? Tell us the story.
The heartbreak was my mom's. My mom had a harder time dealing with that than I did, but it was like an epidemic. I don't know what was going on, but a lot of teenagers during the 90s got pregnant. We A lot of people and a lot of young girls got pregnant. It was actually a issue. It was kind of an issue back then. And it wasn't because there was a lack of
Information?
protection or information. I think that there was just a lack of supervision, and I truly believe that. I'm generation. I consider myself Generation X, and I was always in the streets, and I had a boyfriend, and there, and young kids. We're very
The hormone.
the hormones are crazy, and you're very hot, and I love this young boy, and he was my everything. He was my world. And young love is very hard to control, and you don't realize when you're young how a decision could set the rest of your life up.
How old were you?
I was 16 when I got pregnant and 17 when I had my daughter. Yeah. And she's beautiful. She's a gorgeous woman now. She's 33 years old now. If I look young now, that's I look like a real baby back then having a baby. And that's what they would say to me. "Oh, you're a baby having a baby." And it wasn't I took it like an insult, right? Because I was a mother. I woke up at night, I fed my kids, I made sure that they were fed, I made sure that they were bathed, I made sure that they got up in the morning for school. So I did everything other mothers would do, but when you're a teenage mother, there's a stigma with it. And so you get stigmatized a lot, and you go through that discrimination. And I went through that, as a young mom. And it was hard, but it also helped me again to develop that backbone that I have now. But what I did do was I hung in there, I hung in there with them.
How did you have to leave, drop school? Did you have support from your family? How did you handle? Because you had a second kid also with the
Mhm.
same boyfriend.
Yeah, yeah. So me and him got married at 18. I got married at 18. Um, with my kid's father. The thing is that when you get married young, it doesn't really last, right? So we ended up breaking up young, and I ended up being a single mother of two children. And that was a very hard time for me. I ended up on welfare. I ended up I did not leave school. That's one thing, Christina, I never did. I never left school. I always went to school. I always made sure that and I went to school and I worked part time, but my mom was my support system. In the beginning, when I first had my daughter, me and my mom didn't get along. And so I was in the street homeless because of me, because of my attitude issues. And my mother wasn't, as a Spanish mom, she just didn't have the capacity or the patience to deal with me, because she had two other daughters right before me that did the same thing, right? So by the time I came into I came with, belly with the pregnancy and all this stuff. She was like, she had it. She was done. A lot of the reason I ended up in the street was because of the bad choices I made. But then after I had my son, I matured a little bit more, and my mom was everything. She was the only person, her and God was the only ones that held me up at the time.
What did you learn that we can share with our listeners, our viewers? I mean, the bad choices and the good choices, and just to the mothers and to those young daughters and sons also of not having a family so early. What would you say?
I do think that if you end up having a pregnancy, I don't advocate abortion, Christina. I would never advocate abortion. But I will say that anytime something negative happens, something good behind it can come out of that, you know? So it's like, and it all has to be with that you have to believe that things are going to get better, that things are, even though this is what you're dealing with right now, that it's going to pass. I remember when my kids were crying and they were both crying at the same time. And I'm here trying to understand how to how to deal with these two babies. And I'm a baby, right? And I'm alone. And I remember dealing with this and praying to God. And God provided me that strength that I needed to get me through that day in a bad moment or in a bad situation or even making a bad choice. Something good could come from it.
So, what would you
And
tell the mothers and the daughters? What didn't they tell you, or what did you learn to avoid unwanted pregnancy at such a young age?
so, well, if you don't protect yourself, you're going to get pregnant. That's going to get pregnant, right? But more than that, you cannot give that baby what they need at your age, at trying when you don't have your life together, when you don't have your ducks in a row. But you cannot give a child the foundation that they need. It is a complete disservice to try to have a child when you're young.
That mothers should talk more to their kids about it. Is that what's missing? Why would a young person get pregnant, let's say, in general? Is lack of education, is lack of information. It happens no matter what sometimes, right? But how can we avoid these unwanted circumstances?
Well, I would say communication is probably very important between you and your daughter, right? Because you and your father, both parents should take a part in that, right? It shouldn't always be the mom being the communicator. Teaching your child to have self-esteem. I think that the self-esteem of a human being is what makes them make good choices or bad choices, right?
I think you got it. You nailed it.
So when you build that person up, when you're building that child up to feel good about themselves and they have goals and they have they have a plan, right? And if you kind of like help them see that if you do certain things, then you're going to mess up those goals. You're going to mess up those plans. I think that taking your conversation in that direction rather than eating them because they have these feelings and these desires for another human being. I think that that's the direction you want to have that conversation. Showing them that they can actually be this awesome human being, and then when they're ready, be this awesome mother. I didn't have that conversation with my mom.
Oh, pobre
My mom went through a lot with us. Yeah, but she was so my best friend is my mother now. So it's amazing. It's an amazing.
That's wonderful. So
Mhm.
now let's go to your career because you ended up going to college, right? How do you do that and embracing? How do you get into healthcare? Because you're a broker, and we're going to talk about that now
Okay.
that we know Frances and her amazing story of resilience, right? And turning around adversity to
Mhm.
finding her purpose.
So
How did you get into healthcare?
well, healthcare. So that was by accident. I told you I never stopped going to school, right, Cristina? So I became a professional student. And another thing was that I wanted to raise my kids and I didn't want them to feel poor. We were very poor. But the reason they never felt poor was because I would take out student loans to give them the kind of lifestyle, to give them the Walt Disney, to give them the lessons they needed. I put myself in a lot of financial debt but I still went to school. So I took out the student loans, I paid for classes, and then I also had enough left over to to give them what they wanted. And then I went all the way up to my master's degree. And while I was taking my master's, I had to take an internship. And this internship was at Emblem Health. And the Emblem Health internship turned into a part time job. And again, through Emblem Health. And I was working with the sales department. And they wanted some people to do some field work, right? And I didn't know what it was, but I wanted to get out of the office so bad, Cristina, that I was going to do anything to get out of the office. So I was like, yeah, sign me up. I want to do it. So they were like, you have to take your life and health license in order for you to be out in the field and do this type of job. But I studied my butt off. I studied, and I got my license. But nothing did for me what my license does for me. Nothing compared. When I went out of college to look for a job with my master's degree, they wanted to start me off at entry level and it wasn't a lot of money, right? So I discovered very fast that I wasn't going to be able to work non for profit and make good income. So I took a for profit job. And what I kind of see myself with healthcare, and this is the beauty of what I learned, was I was doing both. I was doing service work, which was what I went into school for, right? I went to school for sociology and for human services. And I was doing all of that, incorporating that with my work with the healthcare. And then I started going to these people's homes and teaching them about their health plan and helping them get Medicaid. And, I really found that I enjoyed doing that. And that's what led me into the world of healthcare.
That's wonderful. So we're going to go now into healthcare. We know, like, you're a resilient person. You inspire
Mhm,
people, like, about you can turn your life around,
mhm,
right? And how to find your purpose, and you found it, helping people
mhm,
through healthcare. I have to tell you that you're a broker. We'll talk about it now. So what I'm saying is that sometimes there are things we should know that we don't know, that if we
mhm.
know them can save us a lot of money. So
Yeah.
tell us a bit about what is a broker, who needs a broker, how
Mhm.
much does it cost,
Okay.
and what can you do? What can you do for people that you cannot do by yourself for yourself?
So I am an insurance broker. I help people with both life and healthcare insurance, and I help them choose the plan that works best for them, right? So when you're a broker, you're not captive to any one company. You're an independent agent and you work for multiple companies so that you can give your clients the best choice, right? The way that you know that I'm a broker is because I have a national producer number. That national producer number, I send it to every one of my clients before I go to their home. And that's how you know that I'm legitimate.
How do you know then a good one from a one that's just
Right.
legit because they have the number? We'll give you Francis information, but we're not sponsoring or getting paid for anything. This is an
Right.
interview, and if you guys wanna have her information, we'll provide it in the description.
So a good broker is going to do a few things. A good broker, first off, is going to follow the rules. And so I send them that scope of appointment that I mentioned to you. The rule is to do it 48 hours before you sit with them at an appointment. That does two things for us. That secures an appointment, right, with them, but it also makes them understand that I am going to be knocking on their door So they're going to do a few things. The needs assessment is one. The second thing they're going to do is once they find out what their needs are, they're going to look and compare, their different healthcare plans with them. See if their doctors that they're currently taking are in that health plan so that they don't have to change doctors, right? They could keep their doctors and also make sure that their medications are in the formulary. They're going to also go over this summary of benefits with them. It tells them what their maximum out of pocket for the year is going to be and what their cost share is going to be. So Medicare covers people up to 80%. And when you join a Medicare Advantage or a Med Sub plan, they cover a Medicare Advantage plan shares the cost of the 20% cost share, and a Medigap or supplemental plan, it covers the 20% for them. So depending on which route they decide to take, because everybody has a different situation, that's when you know what you can actually present to them. And so it should take that appointment should take at least an hour. It shouldn't be an in and out type of deal. Nobody, if a person signs you up right away and they're out of your house within 20 minutes, that's not a good broker.
And what about like, do you follow up after once you sign them up?
Yeah.
You have to, if they have any problems, any issues, are you out of the picture or the
No,
broker is in the picture?
the broker should stay in the picture because what a broker gets from the carrier, we get renewals, right? We get a monthly
If
renewal, but yeah, we get paid from the carriers. The carriers pay us to have, like, let's say, Christina, you stay in my book of business for the whole year. When you first come in for the first year, I get paid for you up front, right? But the following year, you're still in my book of business. I get paid to retain you. So if I don't reach out to you, if I don't follow up with you, if I don't call you, if I just completely act like I disappeared, well, then you have the right to find a different broker.
Hey
So
guys, this is so important. You don't have to pay for this service because they get paid. They do get paid from the carrier.
the
Okay.
care.
Okay. And so, what are the things that people don't know about insurance that that covers? Like, they don't think about dental, eye, any other things?
Right. So original Medicare doesn't cover dental, hearing, or vision. It doesn't cover these very important things. And everybody needs this type of care, right? Because what happens when you get older, everything starts to fall apart. So a Medicare Advantage plan, and the advantage of a Medicare Advantage plan is that most of them come with those additional benefits. Now, if let's say you don't have a Medicare Advantage plan and you choose to have a supplemental plan, well, there are plans that you can pay. You can get like a dental vision plan separate.
What kind of clients does a broker help? Like Medicare, people that are self-employed, people that have employment. What are the people that should benefit of a broker?
It depends on what they are licensed to do or appointed to do. So I am appointed with Penny, who works with the people that are under 65 age. So anybody that is over the age of 18 to 64, I could put in the penny plan, or in the Affordable Care Act plans. That's how some people know it, or the Obamacare. People know it by different things. A lot of people they don't realize that Penny is insurance through the marketplace. And I help people through the marketplace with Penny. That's what it's called in the state of Pennsylvania. In other states have different names for some of it just says marketplace, some of it says Obamacare.
But
Right.
what are the big changes now for this new year, 2025, 26? Many things are changing in the health insurance, and people are a little bit scared.
Well, the big change is for people under the age of 65 that are going to get their insurance through the marketplace is, of course, the credits that they once were able to get, they're no longer going to be entitled for.
Can you
So
explain that, please?
that's hard to explain even for the people that they put it in place. They don't know how to explain it. What I can say is that it's going to be, if you're at a certain income bracket, your premiums might be a lot higher. You're not going to get all of the credit that you were getting for the last couple of
Or the
years.
coverage, you mean?
Yeah, the coverage
Alright.
that they get credit. in the marketplace, they get credit, right? And that credit is based on their income. And that allows them to either have to pay for a premium or not pay for a premium, or it allows them that credit that we're talking about that they get is it's called APTC. Some of it they had other credits that covered the deductible and the co-payments. Well, this year, a lot of people aren't getting that. They're going to pay more.
People do about that? What should they look for? Do you have to go to a broker? Do you need to, is it better to change plan insurances or
Sometimes
keep the
you
same
have
ones every year? What is better? Like if you have a previous illness or a chronic illness and you change plan insurances, does it cover it, keep covering it in the new plan?
Well, when we're talking about that's a question, and I'm going to take that question in parts because when we're talking about people that are in the under the marketplace, then a chronic illness, they don't consider that. What they consider is income in that situation. For people that have, and then now we're talking about a different group of people that get Medicare and Medicaid. What they consider for eligibility purposes is whether you're over the age of 65, whether you have Part A and Part B, and whether you're eligible for Medicaid based on your income. And that's what they look for. Now, the difference between Medicare Advantage and Medigap plans, and this is where that's different. With a Medigap plan, after the first 6 months of a supplemental or Medigap plan, you have a guaranteed issue. You're guaranteed, no matter what your chronic illness is, to be able to apply for a secondary supplemental plan or a Medigap plan. But after that 6 months, you're no longer given that guaranteed issue unless there's a special circumstance, right? So after that 6 months, then you go through underwriting, and a chronic health issue can be a determination on how much you pay for that premium.
So six
If
months, you turn 65, you have 6 months. Don't remember, go to a
yeah.
broker. So what can people do with all these changes that you're talking about 2026?
So there's two changes that I do want to mention. One thing that with the penny or the under six the marketplace people from 18 to 64, they just have to have a good idea of how much income they're going to be making for the following year, right? Because penny bases their coverage or their credit that they give you based on your income, your projected income, right? So you have to be sure that you're giving them the right projected income because you don't want to fall into a situation where you gave them that you were going to get paid all of this income and then you don't get paid, or you give them less, you report less income and then they charge you back on your U2s because that's how they're going to get paid back. They're going to get paid once they see how much income you made for that year. So that's what's really important with them. Difference now with Medicare, it's for the people that I think the major difference that's coming in next year is that CMS, which is the abbreviation for the Center for Medicare and Medicaid, they decided that they were going to set a new rule for those people that have Medicare and Medicaid that get the over-the-counter or wellness program, that now they abbreviated SSBCI. But the point of that abbreviation is that they have to have a chronic illness in order to be eligible for that wellness benefit. And a lot of people have really become dependent on this benefit. So if they don't have a chronic issue, they're going to be denied that benefit next year, or they're going to be given less benefit.
People advocate for what they need because, as I told you, they were going to charge me over $100 that supposedly my insurance was paying, and I still had to pay over 100. And then I found a coupon from the lab, and then I presented it and they said, no, you cannot do both. But then the pharmacist was very nice and she says, no, I am going to put away your insurance. I will just use the coupon, and it was free. So can you imagine how much can you do with $150?
Mhm.
How,
And
what
what
people
you did was very smart. What you did was very smart because there's always a coupon. Always. Manufacturers want to get paid or they want you to try their medication. So sometimes they'll have a coupon. So that you got straight from the manufacturer, and that was very smart. But with insurance, they do have programs that are out there that do help people. I think for Pennsylvania, they have PACE and PACENet. That's an SPAP program. It, and that's basically an elderly pharmaceutical program to assist with those out-of-pocket expenses or co-payments for medication. Some people might be even eligible, and I'm talking about people that are over the age of 65 again. They might be eligible for a program called Extra Help, which is also low income subsidy, and that's a program right through Social Security that can assist them with their medication out of pocket expenses.
So what should
So,
people do? Call the broker, talk to the pharmacist, talk to the company. What are the best avenues for people to save money?
well, ask questions. I would ask questions because you don't know what you don't know. And I can't say if you're younger than 65, there has to be other alternatives as well. Good RX cards work very well. When you see the good RX card, you don't think much of it. A lot of the pharmacies, the smaller pharmacies, they'll have it right there, but those cards really do work.
What? So what you're talking about is in Pennsylvania, you cover other states, or is in general in all the states are more or less similar? All these
So
new changes, all these plans that you're talking about.
the changes that I'm talking about when I speak about the changes with the APTC, that's statewide. That's something that has happened statewide, and that's the credit that people were getting at one point and are no longer getting. And then when we're talking about the SSBCI, that's also federal, where the people are only going to be able to get that assistance if they have a chronic illness. So that is also a federal situation that we're gonna all over the country are gonna be affected by. So the medical assistance that I just spoke about with low income subsidy and extra help, that is countrywide. That is something that everybody in all of the United States are able to get through the Social Security.
I know that you're licensed in different states.
I think 5 now.
Wow.
And yeah, Pennsylvania, New York, New Jersey, Florida, and Texas.
And
Okay.
what about kids? I never knew that kids, I have a 10-year-old, that they had free coverage in Pennsylvania.
A lot of it is based on income, but they can apply online through the Compass website for Pennsylvania. And this is also countrywide. Every state has a program like CHIP, right? CHIP is the program for children.
Dates. What are the dates for healthcare
Okay.
insurance?
Oh,
That's an
yes,
important
yes,
one.
very, very important. So we just finished AEP, the annual enrollment period finished on December 5th. It started October 15th and it finished on December 7th. If you're unhappy with that, then you can have a one-time chance during open enrollment starting January 1st to March 31st to make another change in your health plan. Chronic health plans are throughout the year.
Okay. Thank you so much, Francis. Guys, a broker is somebody you need in your life, a doctor, a lawyer, and a broker,
I think
right?
so. I
Okay.
agree.
I wanted to come back and talk about life insurance and other
That would
insurances.
be great.
So we don't think about those things, but they are
Mhm.
important, right? So let's prepare for that. Okay.
Okay, thank you guys, and thank you, Cristina.
And we will give you your information in the description, your email. And if you have any questions, put them down in comments and we'll Francis will reach out to you with an answer to them. Thank you so
Great.
much. And
Thank you.
you know what? Your story is amazing. You grew up and embraced the most of life.